Just 10 minutes.
Thank you, Concorda. Concorda, I don't intend to personalise this debate as others have on both sides of the House. I think the issue of health care is far too important for that. It's an issue that affects families and individuals the length and breadth of our country. And I've always found Minister Reilly to be a personable kind of man. I've no doubt that Minister Reilly will easily survive the confidence motion tonight, despite the serious misgivings of numerous government backbenchers over the last number of weeks. It's obvious that Minister Reilly gave a rousing speech at the Fine Gael think-in because the benches were full here tonight to show their support. But having, as I predict, you will win in this confidence motion, I would urge you, Minister, I'd urge you to listen to me for a start, and I'd urge you to change tack as you move forward. I acknowledge the strong mandate that the government parties received 18 months ago, a strong mandate that you received to govern. And just as you received that mandate to govern, we received a mandate to hold you to account as the main opposition party. And the mandate that you received was a mandate based on election commitments and promises. And as a Fine Gael spokesperson on health, you made multiple pledges right the length and breadth of the country, and various deputies spoke of the commitments for their respective constituencies. But I want to focus here tonight on two overriding commitments you made. One was that the money would follow the patient, and two, that the HSE to be held accountable and answerable to the Minister of the day. And rightly so. And you, one of the first jobs you came in was you disbanded the board of the HSE and appointed officials from your own department. And it's funny that Minister Fitzgerald is proposing a very similar structure to the HSE for the new Child and Family Services Agency, the exact same structure as the structure that you're dismantling now in the HSE. You were the man who was taking control. There was high hopes out there in the general public. You were a man with considerable experience in the health profession. You had superb negotiating skills. After all, during your time at the helm of the IMO, you negotiated the most lucrative contract in the history of the state for your GPs, a contract that we're still paying for dearly today. But that's where the high hopes ended. You talked last night about reductions in the waiting list time, and that might be easy considering the extension of the time parameters. And while that might be good politics, it's certainly not good for the end users. And various deputies can tell you in their clinics, day in, day out, where they have people coming in explaining about the long delays they have in getting in for the necessary treatment. But we talk primarily about your budget and the estimate that's currently standing with a deficit of €259 million. And while you try to blame the staff and try to blame Croke Park Agreement, can I quote what Minister Howland said? There are some, and I've heard it in recent days, using the Croke Park deal as a shield for their own inactivity. It really isn't funny. It's really not funny. This is a serious issue, and if the ministers would like to listen or maybe leave the chamber if they find it so funny, I don't think it's funny the state the health service is in. But Minister Howland said, using the Croke Park deal as a shield for their own inactivity, a shield in their own activity. You failed to materialise the savings of €124 million in relation to drugs. You failed to materialise the savings of €140 million from changes from the bed designation that hasn't been legislated for. And then, when the proverbial was going to hit the fan, you punched and pounded on the weakest and the most vulnerable in society to achieve the targets set out in your own budget. In no one else's budget, your own budget. And that's when we saw the most weakest and the most vulnerable in society camping outside government buildings because of decisions that you made, that you proposed making. People who depend on personal needs assistance, camping out overnight. And the radios were full, and rightly so, of government backbenchers disgruntled and annoyed at how that had been handled. And rightly so. You talk about cutting home help hours. I spoke about it before, how home help is keeping so many people out of residential care and saving the state tens of millions on an annual basis. Then you set a deadline for the consultants' negotiations. And I'd like the Minister to identify exactly where the 200 million savings is going to be made, considering that it's only the new entrant level consultants whose pay is going to be reduced. Once again, an easy target, a sitting duck for this government. Will attack the new entrants and create a great disparity between the new entrants and the existing people working in the various areas. And then this morning, we had, during leaders' questions, on Taoiseach telling us how he requested his ministers last week to explore how best to squeeze the maximum savings from the Croke Park deal. He asked you last week. Well, I would have thought it would have been appropriate to ask you to look at that on the first week of coming into government, not 18 months later. Can I just go on to the issue of the money following the patient? I've used Mullingar Regional Hospital as an example time and time and time again. And I want to give you some figures tonight, some very recent figures from the hospital. At the end of August 2012, the hospital had 13,593 inpatient charges with an average length of stay of 3.39 days and dealt with 4,748 day case procedures. Overall activity in this hospital is 2.5% ahead of activity for the same time last year, while at the same time running at less than 1.09 million than the same period last year. The hospital has reduced the number of staff working there from 751 to 732. They have reduced the absenteeism rates from 7.96 to 5.45. And my point is, my point is, I don't think it was Minister Reilly, or with due respect and can call it to Minister Lynch, it was either of you that did it. It was the staff of the Midland Regional Hospital in Mullingar that did it. It was the management of the Midland Regional Hospital in Mullingar that did it. And I ask you, Minister, as I asked you time and time and time again, they have been doing it repeatedly over the years, and that's why for the last 5 years they have been one of the most efficient hospitals in this country. And I ask you, as I asked you before, Minister, to come and visit the hospital. You were in Westmeath a number of months ago. You opened a new long-term residential care. Very welcome, but you never went over and looked at that hospital.
Thank you,
Minister,
would you please?
Minister, can I finish? Can I make a concluding remark? As opposition health spokesperson, you said you'd walk if you had to cut and affect frontline services.
Thank you.
I know you're not going to walk tonight, but please change tack and you will get support from all members.